So, hello friends. Ted Taylor and I, Susan Hoskins, wanted to do this little video today to talk about the importance of advance directives and having the conversation during this time of COVID-19 pandemic. So I'd like to welcome Ted and ask you if you could talk a little bit about why is it important right now to be having this conversation.
So I'm just going to frame that with why this is important to me. So I've worked for about 20 years as a healthcare chaplain, first in hospice work, and then more recently in acute care medical settings. And part of my work has always been focused on having conversations around end-of-life care planning, the bioethics of end-of-life, palliative care, hospice care. So that's just kind of been part of my professional journey in my ministry for a couple decades now. And what's been just the sudden shift in the way we're talking and thinking about these things because of the coronavirus really prompted me to speak to our pastoral care committee about this, and then kind of got connected with you, Susan, to see if we can share this kind of concern and some information to the wider community of friends. So why it's important and what has shifted is that this is a virus that none of us have ever had before. All of us are susceptible to getting ill, and it is overwhelming our healthcare systems globally. And in doing that, it's pushing the way we take care of people to the edge and forcing us to make decisions in a different way than we typically would. It's reminding us that resources aren't always available, and including medical equipment and people, and that life is fragile. It's really bringing that right to the forefront. So that's what I've been seeing over the last several weeks in my work as a clinical chaplain, and I guess noticing that some people were having good conversations with their families about this, and some of my patients and families really weren't there at all, prompted me to have this conversation with you.
I think also in my work as a geriatric social worker, I think one of the saddest things that I've heard in the last couple of weeks is the number of family members that can't be with their family member who's either in a hospital or in a skilled nursing facility, and they know that they're not faring well, but really can't sit down then and begin to talk.
Right. And even taking that a step further, what the really tough part is that people are coming to these end-of-life experiences in ways that no one had expected or really, I don't think, wants, which is such isolation from the people that you love. And so I think that's to be taken into consideration as we're walking through this time, is that all the healthcare centers, nursing homes, hospitals, assisted living facilities are all on lockdown. Visitors are rarely if ever able to get in to visit. And so, I think that does change how we consider what we would want to be happening at the end of our lives.
And makes your role even more important, because you are the person who's on the inside sitting at the bedside.
Yeah,
so
I've been
thank
doing
you.
a lot of navigating work. So it's running an iPad or iPhone over and FaceTiming or Zooming families together, and assisting our nurses who are actually going into these rooms where patients are on ventilators and are positive for the COVID virus, and them doing the holding and touching and caring, and it's so different from anything I've ever experienced in my life. So.
And I think that's one of the things that you and I have talked about before too, is that when people sit down to fill out an advance directive, they're all often envisioning what happened to Great Aunt Sally or something, and what you're saying is that what you're encountering now doesn't always look like those things we envision.
Yeah, this disease is difficult. I mean, it's because it's challenging those who are already medically fragile. It's challenging those who are in advancing age. And we've seen the statistics out there that people don't do as well with this virus and with the COVID disease if they have all those pre-existing conditions. People get sick very fast, and that's the sad thing that I've noticed. I'll be doing a graveside service for one of our patients tomorrow, who came into the hospital one day and cardiac arrested and from the COVID virus the next. And no one expected this 62-year-old woman without any diseases before to have that experience. And so that's, I think, the pressure maybe is to let's have these conversations now, because it's different. This disease is different. This time is different. Our resources are different. The whole situation, I think, is really encouraging us to maybe have conversations we never wanted to have, or at least avoided.
Well, I think when I've done workshops on this, people would say, yeah, I've been meaning to do this for a while, but I don't know how to start the conversation, or I don't know which of my children to pick, or, there's some barrier that's there. So what can people do right now?
Right. So, what I've been encouraging, and even on some phone calls with family members, is to start planting some seeds, but to say this is the time to talk about this. And there's a couple things you can do within that conversation at the end of it. So one is to, like you were saying, is there somebody who you want to make these decisions for you? Someone who knows your values, and if you get to the point you're so sick that you can't speak, who would speak for you? Who knows what you want to happen at that time? And if that's not already kind of an easily apparent, then it is really good to have that written out in what's called a medical proxy. It's one key part of an advance directive document, and it can go a long way to help everybody make decisions in a time of crisis. The other part of that advance directive document is, and that kind of comes out of those conversations, as difficult as they are, is a written part where you write down what are the things that are important to you. What would you want if you got so sick that you couldn't get better? And to have that written down can then help the person that you've chosen to make those decisions for you make those decisions. It's kind of there in your handwriting. And most of the documents that are out there, each state has its own form, and there's plenty online, and there's a great document called 5 Wishes that really does a great job of talking through each of these parts of that conversation.
And we'll put those up on a screen at the end of the talk so people can write those links down.
Links to advance directive documents.
So this is really more than just writing this out on a piece of note paper.
I mean, that's better than nothing. So that can be a guide to your family. But I think having a deep, my husband and I had this conversation again. We've had advanced directives for years. But I'm in the thick of it. I could get this virus at any time, but any of us could. But sitting there working in an acute care or hospital setting, I'm around it. And I told him if I'm on a ventilator and it's been more than 6 or 7 days and I'm not improving, at that point I feel like my life is complete. And if there is somebody else who could use that ventilator, please take me off of it and let me go with peace and give it to someone else who could do better. Now, that was a hard conversation, and neither of us slept too well after it.
Yeah.
But the next day, there was some peace about it. And so that is the reality we're living in right now.
Well, one of the real gifts there to someone that you love very much is making it very clear what your thinking is, so that should that awful moment come, he won't say, I don't know the answer to this question.
Right.
And then people turn to the doctor or whoever's in the room and say, well, what would you do? But you've been really clear with him.
Right.
So
and of
if
course, neither one of us right now in our lives parents are in a place where we're medically fragile, so I haven't adopted a document called a post form for me or for him. But those are documents that you could also have in place right now too. Post documents are actually medical orders. They are completed by an individual and or their proxy, and the physician or advanced practice nurse that you would work with to have the conversation about what if. What if I got so sick that my breathing stopped, my heart stopped? In that case, based upon everything else going on in my life, what goals do I have at that point? And so this is a time to really be, I think, proactive and clear about having that document completed as well. It's a medical order that is portable, meaning that it follows you wherever you are. If the EMTs come to your house, they would follow it. If you are finding yourself in a nursing care facility already there, they will follow that. Even if you're transferred over to the hospital will follow it. And so it alleviates, again, some of that emergency decision making because it's already been decided. You've had that conversation with someone who knows your health care, who knows your values because you've had the conversation with your healthcare provider, and then you write it down on that document.
So it sounds like there's really two parts to what you're recommending. One is to fill out that advance directive or 5 wishes or that whatever the form is in your state, that to fill out the paperwork and get it witnessed so that it's legal. And the second part is to have the conversation with family so that when they're in that really high stress time of being asked to make decisions, they know what your wishes are.
And if you have, so filling out the advance directive documents after that conversation with your family, it is a legal document. And thankfully you don't have to have an attorney to complete it. You can make it legal just by having 2 witnesses, people that are not direct caregivers or people you've named as your proxy, can witness that document. So I've heard of a lot of legal documents now being completed on people's front porches. You just lay the document out there, you call a couple of neighbors and say, do you mind witnessing this for me? And you leave the signed document out there, and people come over, bring their own pens, and witness the document. Both Pennsylvania and New Jersey I'm aware of, and most states, it only takes 2 witnesses, and you're witnessing that that's the person who signed it, and you're witnessing that they're doing it of clear conscience and not under duress. They know what they're signing to. And that makes it legal. And then you make sure that you have copies sent to all of your care providers. You take a copy with you if God forbid, you have to get to the hospital. And you keep the original in a safe place at home. With all the other special documents so that people can get to it if they need to.
Good idea to tell family where that special drawer is too.
Yeah, and again, it's hard to think about all these things, but that includes passwords into your computer. It includes the copies of insurance certificates and numbers that are people that you might need to contact. Again, if you get so sick that someone needs to take care of things on your behalf.
It sounds like from your example too that people who have already filled out a post or an advance directive, it's not a bad idea to take a look at it again. And oftentimes these conversations are not one marathon session, but little pieces. Uncle Harold died and this happened. What would you want me to do if that happened to you? And you have a little bit of it, and then somebody says, that's enough of that, let's move on.
I think you're right. These conversations continue to evolve. So more experience teaches us more things. Whether your health itself continues to change, and you say, wait a second, what I knew I wanted 6 months or a year ago, now where I am is different, and this is how I would want things now. And again, in light of knowing that if it means being in an institution, that might be a very lonely place to be. And then also, like you said, the experience of seeing others going through this experience can challenge and change the way we think about things for ourselves.
What ways do you recommend that somebody start that conversation? Particularly if you're not sick. I mean, obviously, if somebody's been rushed off to the hospital, then the whole family starts thinking, oh, do you know what mom wants? Did dad ever talk to you? Kind of thing. But I find that people have a hard time just getting the ball rolling.
Right. I think sometimes the thing is to set aside a special time that gives space for conversation, and to introduce it by saying, we need to talk about something important to me, and then kind of let it sit for a second and say, so here's what I want to talk about, and maybe introduce things like, if this happens, these are things I've been thinking about. Let me share that with you, and then have a dialogue over it. What do you think? And I know sometimes the people that love us don't want to go there, but to ask their indulgence and respect for your need to have some peace and to be settled in some of these things. And if it's pushing stuff, then I usually say, well, don't push anybody. If they're not able to hear you, it doesn't do anyone good to get mad about it. But to say, well, if this is not a good time, do you mind if we try this conversation some other time? And you tell me when it might be easier. I know for me, having these conversations at the very end of the day would be very taxing. I'm a morning person, so I might say, look, maybe not tonight, Dad, but can you give me a call back in the morning, and let's just set aside a half hour over coffee on the phone or on Zoom or however we're going to do it, and talk through this.
One of the other real benefits of technology today is that we actually can record those things. So, like our talking now over Zoom or using a phone, you can do that as a recording, so that if your kids don't want to hear about it right now, you can.
Great point.
Somebody like Ted has the recording.
You just sit there and hold your phone in front of you and do a video and saying, I know this might not be what you guys want to hear, but let me tell you what's important to me right now.
Yeah.
And then send it to them, so that it is captured somewhere, and they have that as a resource.
And that helps cut down on the mom told me this, but mom told me that kind of conflict. I've also suggested to people that don't wait until all of your children and grandchildren are in the room and ready to hear it, because that's not likely to happen. But start with the one who is most likely to be receptive to having the conversation. And especially if you record that conversation, then that one can disseminate the information to their siblings.
That's a great idea, Susan. Yeah. So again, if the paperwork isn't going to work out, that's so much better than never having the conversation at all. And I think there's video documentation. I can tell you, being in a hospital, if someone said, well, here's what my mom said, and showed the video to the care team, there'd be no question.
Uh-huh.
Yeah, it's pretty powerful to have someone in their own voice and their own face telling you what's important to them.
Absolutely. I have 2 adult children, sons. Should they be doing this too?
And the simple and quick answer, yes. So, in normal pre-COVID times, this answer is yes. But I think, again, as I've been saying, these times are different, and there's a sense of urgency because even young people are getting the disease. Mm-hmm. And even though most of them recover very, very well, the age at the hospital of people coming in with coronavirus symptoms is getting lower and lower. I've seen people in their 30s. So,
a friend of mine who's a doctor had a 3-month-old patient this week.
Yeah. So if you're 18 and older, you have the ability to complete these legal documents, and you have the legal right to have your wishes fulfilled, and to set aside somebody who would do this for you, and to document what's important to you. And like you said, even document it by video, what's important to you. And again, I hope we never get there with anybody, but if we have to, then at least we have something that helps us navigate this. And I'm saying this the other side of me is saying this is part of a bioethics issue. we might get to a point before we want to that we're not going to have the equipment, the resources to care for everybody who needs that level of care, which is kind of sad, shocking, and frightening. But if we have to start allocating resources in such a difficult time, already having this done is a huge help to the whole of us, to all of us. If we have someone coming into our ICU who already has a pulse document that says, do not intubate, do not resuscitate, if I get sicker, just keep me comfortable, then we can allocate that rare resource to someone else who might be able to survive by using a ventilator. To me, this kind of connects into some core Quaker values, which I've been trying to work with as I've been thinking through the bioethics of this. And I serve on our systems bioethics oversight committee and with our local hospitals bioethics and the state of New Jersey's medical bioethics committee, and we've been wrestling for over a month with potential guidelines on how to do this. And for me, it comes down to this idea of our sense of stewardship and community that undergirds some core Quaker values. And community in the bigger sense, not just the Quaker community, but maybe the global community. And how can I be a good global citizen and take the time to think through what is important right now and make sure that's get communicated so the most people can get benefit who might need resources that I don't need at this point, and making that very, very clear. And I think it also, ties into our ideas of simplicity of life and being very clear about what life is about, and good stewardship of limited resources. So those are the ways I've been trying to frame all of this, because I'm usually very good about framing bioethics in terms of a Quaker commitment to the individual and the light within, and how unique each of us is with that divine spark. But now I'm opening that divine spark to be a planetary light holding, and thinking, how do we do this in terms of all of us being in a community that needs community level care.
Thank you. That's a really important perspective. I was thinking a minute ago too, when you were talking about the bioethics, that I imagine that there's another question here, and that is a person's right to decide to stay home and not go into the medical system. That I've been hearing that some people are saying, I'm really determined to die at home, and not to take that additional level of care.
Yeah, I know this is, and it's difficult on so many levels because it stresses the hospice care system as well. But I guess the benefit of having that decision ahead of time, saying, look, if I get this sick, I just want to stay home, call in a hospice team to help support me in this. And that does challenge your family, especially if you are sick with COVID-19. How do they keep themselves as your direct caregivers in that house well? And then bringing in hospice teams into your home is challenging as well, but it's being done.
But that's
my sister works in hospice care in Maryland. She's relating to me some of these challenges, and I'm working with our hospice team in the hospital and working through some of the challenges there. But to me, it does, connect to people's individual values and their autonomy to make choices about how they want that time to be. And again, I keep on saying, do you want that time to be in a hospital, or do you want it to be at home, around the people that love you?
I'm so glad you brought up hospice, because I think it's important for families to know, if they're hearing that from their family member, to know that they don't have to be alone with it. That hospice teams are going out into the community and will support a family through this time. So,
and they'll do great teaching on how to do good infection prevention and infection control, but also great comfort care, and to make it a dignified experience for people. it's again, there's an urgency that I'm noticing that I think we just need to pay attention to.
I'm so glad that we had this conversation today, and we want to spread it around through the Friends community. Any other points that you thought of you want to add?
I think I'm good. I can just tell you what you see on TV is pretty accurate. That the situation that we're in is so different from anything we've ever experienced. I have had opportunities to try to help people make connections, both with video experiences or telephonic experiences, and very rarely shepherding a family member at a time for a 5-minute visit. If their patient or loved one, if the patient is positive for the coronavirus, they can't even go into the room. They can only see the body of their loved one through a window, which is just heartbreaking. And so I'm sounding like a broken record, but this is so different than any way that I've done pastoral care, we've done caring for ourselves at end of life, we've done care for anyone in the healthcare system, that I want us just to be thoughtful and think ahead of how we would want this to be for us if we got to that point.
I hope you're taking good care of yourself.
I'm trying to. I left work early so I could talk to you. So I'm talking from my home and not from the office. And I'm getting good food, and I'm worshiping with my Quaker community via Zoom, and being spiritually nurtured by some dear friends. So all that's helpful.
Great. Thank you very much for this conversation.
Yeah. I hope we help a lot of other friends.
Thanks.
It's good to talk to you, Susan. Thanks.
Yeah.